Hi, everybody. Welcome back to another episode of Wellness Wednesdays with me, Yehudis Schamroth, the nurse anesthetist and acupuncturist and herbalist in Jerusalem and Ramat Beit Shemesh, Israel. I made a mistake on the timing. I put the advertisement out for 3 o'clock, but it's actually 2, so I'm an hour ahead of myself. So sorry about that. Today's topic is not unlike others, where I'd like to cover issues in depth to talk about anything health and wellness related. Today's episode is no different. We're going to talk about infertility and how you can increase your infertility. And we have a special guest who happens to be my daughter-in-law and a very world-renowned expert on infertility issues. She's a registered nurse as well as I am. Today's topic is the most commonly asked questions about infertility and IVF treatments. Now, this 1 hour program is not going to do the whole topic justice. So we're going to just cover basic things. I'm going to give an introduction, a little bit about the menstrual cycle, a little bit about infertility, and then we'll show my interview, my pre-recorded interview with Kimberly Shamroth, same last name as me. If you have any issues about any kind of medical problem or issues that you haven't been able to resolve medically, come and see me. And if you're in the area for acupuncture and Chinese medicine, and I also see patients for infertility as well and help them prepare them for pregnancy, both men and women. Okay, I want to go to slides right now, and I'm going to share. Okay, we're sharing, not here. Oh wow, this is interesting. I'm not allowed to share. Try your screen. Here we go. Now we're going to share. Okay. There we go. Here we are. Hi, Kim. We're going to see you in a few minutes. So first of all, I just want to say that infertility is a very touchy issue. It's a very emotional issue. It's a very private issue. When I was doing my research on which slides to use, every single slide showed a picture of people in agony and anguish and crying, and men and women back to back, not talking to each other. I just felt like, that was just something that we forget to emphasize, that it's a very emotionally charged issue. It can take some people many, many years to conceive, and the problems are many, not just the infertility themselves. So this program today is not going to address the psychological impact, but I can say that what you hear today and what you see your friends going through is probably a microcosm of what really, really happens to them, and they don't share it with you because, again, it's a very private thing. Don't want to give a fully in-depth course on medical female issues or even menstruation, but I think it's worth mentioning because even though men and women are almost equally the same, the causes due to infertility can be equally attributed to men and women. I know that women are the ones that I see the most, and a lot of men are not interested in coming in, or they don't think they have much to do with it. But in any case, let's just talk about, I'll mention that in a minute. I just want to give an overview of the menstrual cycle. We know that halfway through the cycle is ovulation time, and that's when it's the most propitious time for a person to get pregnant. And we want to make sure everybody's in very good health. And while you're trying to get pregnant, I know people take prenatal vitamins and try to get a little bit healthier. Kimmy will explain to us the definition of infertility and what she sees and how she counsels people. But just the regular menstrual cycle is usually about 28 days, and we know the first 7 days approximately are the days of bleeding. That's when the menstrual tissues shed their linings, and that's when we bleed. But that's not the whole story about the menstruation. There's a lot going on behind the scenes. There's 4 different cycles, as you can see by this picture. Menstruation, I have a different slide. It's not as clear. Menstruation, there's a follicular phase, there's ovulation, and then there's the luteal phase, and they involve talking about hormones, estrogen and progesterone, which I'm not going to do today. But we know there's different phases where the uterus builds up estrogen and progesterone, and then when it releases, you have your bleeding. And if you have any indications that you are not having irregular periods, or if you're not sure what's going on, if you're not having any periods at all, it's something you should really look into, medically speaking. Now, I'm a nurse, and I've been opening my eyes over the years to the powers of alternative medicine, but I always look at things medically first and foremost. because you have to know what you're dealing with. So if you have any issues at all or questions about whether or not you have infertility issues or if you have irregularities, you need to go visit your local gynecologist who can forward you to somebody specialist in infertility if you need that. So we just know that the menstrual cycle is the term for changes in the women's body that they go through potential pregnancy. Okay, most women have their first period at the age of 11 or 14, and the cycle is about 28 days. And usually they don't bleed more than 6 or 7 days, but that can be a problem as well, or that can be an issue with some people. The importance of a very healthy menstrual cycle cannot be underestimated, because if you don't have a healthy menstrual cycle, and again, I'm just talking about women here. I'm not saying men aren't. We don't have. There are problems with men with infertility as well, which I'll speak about. But women have to have a very healthy body to start with. And here's the causes of infertility. I had the slides a little bit in reverse. You can see the female infertility attributes about 30% of infertility cases, 30% to male. That's equal. 20% are mixed and 20% are unexplained. So we're still, after all these years, not 100% sure what causes. We can't say that's your fault or it's your fault or it's your problem or your genetics. And it's not valuable to do that anyway, because it's, again, a very emotionally charged issue. And it's difficult enough without blaming and pointing fingers. So we know that the menstruation prepares the body for pregnancy. And if it doesn't go that well, we have a problem. And even if you're not trying to get pregnant, there are people who have difficulty with their periods, and they have irregularities, that painful periods, late periods, early periods. That's all the kind of thing you want to talk to your doctor about, and also come to a Chinese medicine practitioner who can help get your body in a healthier state so things get regular. Okay, so you want to keep your health and your psychology in check to start with before you start looking for the causes. But female fertility can be affected by your age, tubal diseases, fallopian tubes, ovulation disorders, endometriosis, polycystic ovarian disease, fibroids. There's something called salpingitis, which is pelvic inflammatory disease, which is an infection that doesn't go away and can cause a lot of damage and scar tissue to the tubes and block the tubes up. And you can have sexually transmitted diseases. And believe me, there's so many more things. I'm probably going to miss many of them. Again, there's the ovulation, aging, premature ovarian failure is a diagnosis. These are people who have exposure also to medications, chemotherapy, heavy metals, toxins, and things like this, infections, fibroids, things that, you have to go and get it medically checked out to see what's going on with you. And sometimes once you clear the issue up, you can get pregnant very easily. Okay, you want to have what we call a condition for healthy conception. Okay, you want to have your body in a state where you're tip-top shape. I mean, some people get pregnant anyway, even when they're exhausted. I work in a community of women who are on their 9th children, and they're exhausted and they're wiped out, and there's no way they're in their tip-top shape, but they just have very good constitutions, I guess. But the condition for a healthy conception is that you want to make sure all the tubes are clear. You want to make sure there's no infection. You want to make sure you have regular periods and regular ovulations, and you want to make sure that all membranes are intact and all the follicles, are in good, healthy shape. And you don't know this unless you have blood tests taken and you check your hormone levels. And before you worry about it, just make sure you go to your OBGYN and have some preliminary tests done. And you'll see if you're in a good condition for a healthy conception. One more thing I wanted to mention about women, and that before we get to the men, is that birth control, many, many years of birth control can cause problems with the menstrual cycle. It takes a while for the body to bounce back and start to menstruate on its own. It can make your period shorter and lighter, of course, and that's wonderful sometimes. But when you're trying to get pregnant, it's not always what you're looking for. Polycystic ovarian disease, I mentioned before. It's a hormonal imbalance, and one of the primary causes of infertility, causes irregular menstrual cycles. Inflammation in the pelvic areas, I mentioned. Eating disorders, I didn't mention. Eating disorders are very disruptive, and if you have a poor or lack of nutrition, you're starving yourself, and the body knows how to take care of itself. So if the body senses that it's malnutrition, it's not going to allow you to get pregnant. And most girls who do have eating disorders don't even have their periods at all. We know anorexia, bulimia, and all the very difficult ones. So an imbalance of hormone can also happen. So once you start trying to work on balancing your hormones with a regular traditional Western medicine or Chinese medicine or both, which is what I recommend, it can take up to 4 months to really regulate your hormones. And you want to improve your blood sugar and a healthier body overall. Because any abnormality in each link can lead to infertility. I think a lot of the stuff I have is repetitive. I want to also mention obesity, chronic stress, poor sleep or insomnia. This can affect men and women. Dietary and lifestyle factors like caffeine and high sugar and junk food diet, a lack of exercise, and toxicity due to chemicals and heavy metals. So that is a cause for both male and female. Again, there's also autoimmune disorders, which we will go into today. Failure of implantation. There's just unfortunately so many reasons. So that's why it really is important to do a thorough workup and check up with your doctor and with your practitioner of all kinds and blood tests. Now the men, they can also have difficulties for the lifestyle issues that I mentioned, like the poor diet, lack of exercise. It can be from a sexually transmitted disease. They can have endocrine causes. They can have testicular damage, something congenital perhaps, seminal plasma abnormality, unexplained infertility. There's just sometimes unexplained sexual dysfunction from medications and anti-sperm antibodies. So the men can, because they're equally at risk for infertility, there's a lot of reasons for them as well. Varicocele is another. And one of the most common things we see is low sperm count and production, hormone imbalances with them too, ejaculation problems, complications from radiation therapy or surgery, unhealthy lifestyle, again, as I mentioned, too much stress and anxiety. And then there's, of course, those unknown causes that we talk about. We don't know what they are. So what I wanted to just mention before I bring Kimmy's interview on is how can the role of Chinese medicine help you with any kind of infertility issues? Can it help you? We know the fertility treatments with traditional Chinese medicine is similar to soil in the garden. The seed has a better chance of growing if it's well nourished. So one of the things I'd like to keep in mind is that your general health is really the most important thing to start with. And if fertility is desired, so the first order of business is to optimize your physical and emotional health of both the parents. That's a Western philosophy as well as a Chinese philosophy. So the fetus is a product of both the male and the female. So ideally, you want to take about 3 to 6 months ahead of time to clean up your physical self, if you can possibly do that. If you're dependent on any kind of drugs or alcohol, if you're trying to get better sleep, all the basics. If you're trying to drink more water, all the things we're supposed to do, and taking them prenatal vitamins and increasing good nutrition, healthy whole foods, and lots of fruits and vegetables. This is the kind of thing you might have to do 3 to 5 months before even trying to conceive. So how can acupuncture help you in Chinese medicine? We know herbal medicines are good at helping heal the body from the inside out. I did a whole webinar on that with my herbal professor, Aliza Levine, who lives in Jerusalem, and I will direct you toward that video, which we did about a year ago, maybe more. And she spoke specifically about how herbal medicines really, really help. And she's on the staff of a few of the Jerusalem hospitals where they won't take care of their infertility patients for in vitro unless they are taking herbs from Aliza, both male and female. So that's how valuable and important, because herbs can do what acupuncture can't do. Herbs add something extra to your body, it's like extra nutrition and extra stimulation and helping the blood flow. Acupuncture is amazing, but the herbs really complement this and take it to a deeper level. So we know that acupuncture can work in tandem also. You want to work with your conventional fertility therapies. So very, very often, and Kimmy might mention this later, that in her clinic, patients I think they're required to have acupuncture along with their infertility IVF treatments. And if they're not required, it's strongly recommended for sure. And TCM is traditional Chinese medicine, and how can it benefit fertility or infertility? So we know it's a non-invasive, natural method. It provides holistic restoration. It aids and enhances Western fertility procedures. So just remember, I'm saying this a lot, that I'd like to do this in combination. You shouldn't do one without the other. It's really, you need both. The Western Philosophy is wonderful and it's great success, but you have greater success and a healthier person to start with if you go look at the if you go with the Eastern route alongside the Western route. TCM treatments are personalized for you, so you get a little bit more possibly of a individualized attention, like Kim does when she gives you her expertise and personal phone calls and evaluations. So how can we help you with? We did this already. Okay, so I'm ready to show the video of my dear daughter-in-law. I just want to see if I left anything else out. Okay, so I'm not going to talk about why acupuncture can diagnose difficulties, but I can tell you we look for the root cause. We look for the root cause, which usually stems from the kidneys and the liver and the digestive system. So if those are weak in people, we're going to strengthen those up for you. If you have a poor blood flow to the reproductive area, we're going to get the blood flow going for you. And what are other things that acupuncture can actually do for women's health overall is that we can help with endometrial thickness. And it's essential to have the thickness to hold the baby. So we can strengthen the lower body so the body can hold on to the pregnancy and not have miscarriages as easily. Acupuncture can do this. It can aid the success of in vitro fertilization. It can help with a lot of stress reduction. And this is what I saw in the medical journals when I was doing research. They say, well, acupuncture may or may not help you, but for sure it reduces overall stress. And stress is the biggest component that sometimes preventing people from getting pregnant because they try over and over again. It's expensive. They lose sleep over it. It's painful to get shots. It's just, there's a lot going on. It's emotional, as I mentioned before. So one thing, if even if you don't believe in acupuncture and you think it's just a placebo effect, know that it will relax you enough to get through all these procedures with a lot more calm and clarity and much less distress for the male and the female. We do know because of the stress reduction, it really shows the cortisol levels also in the brain where they're elevated, they can cause a lot of problems. But again, the acupuncture can help normalize all the hormones and regulate the hormones for both fertility, insulin, all the hormones in the body, and cortisol. It can help with morning sickness if you're pregnant already, anxiety and insomnia also. And as far as the males are concerned, acupuncture can improve sperm quality and motility. And if you're not pregnant and you just want to come and help regulate your menses, your period, at any time of your age, any cycle, girls who haven't started their periods yet and maybe they're late, or girls who have very painful periods, acupuncture reduces period pain and helps regulate the cycle, as I mentioned, and get you back on track. It can also get rid of migraines and headaches associated with menstruation. And I think I mentioned that a couple times in a couple different lectures. So without further ado, though, I can tell you that if you'd like to get a hold of me and have a consultation with me, I'm on Facebook. RBS Acupuncture, which Ramat Beit Shemesh is RBS. I also have a website, which is rbsacupuncture.com. You can contact me anytime. I'll be happy to have a free consultation, 15-minute consultation, and tell you if you're a good candidate for acupuncture for any reason, but especially here's acupuncture, rbsacupuncture.com. That would be me. Okay. So I'm going to bring on the pre-recorded interview of my daughter-in-law, the fertility RN. Let me just make sure I get this on here. Kimberly Samet is her maiden name. And now she's Kimberly Schamroth, thank God. Okay, so everybody, now that we've discussed how does acupuncture and Chinese medicine, nutritional changes, lifestyle changes, and other things can affect fertility, we know that all those changes in the right direction can increase fertility by reducing stress and increasing blood flow to the uterus and reproductive organs, and balancing the endocrine system and all your hormones. So that's the details of the situation, but we really want to speak to an expert on this. Happens to be my daughter-in-law. She's also a nurse, and she's an infertility nurse specialist, and she'll explain it to you. I have the most common questions that people ask her, and her name is Kimberly Schamroth. Let me just say a little bit about Kimberly. Kimberly, who's been married to my son a little over a year, but here's her bio that I don't really know as well. Kimberly Schamroth used to be Samet. She's a registered nurse of over 7 years, and she graduated from New York University School of Nursing in 2015. She spent the last 5 years specializing in reproductive endocrinology, and she's currently getting certified by the American Society for Reproductive Medicine in Fertility. Now, currently, she works with clients privately to help them learn more about their reproductive cycle and how to navigate in the field of IVF, which is very overwhelming for many, many people. And she works both in America and Israel. She works internationally, online, in person, and she'll tell us all those things right now. So thank you for joining me, Kim.
Thank you, Yehudis, so much for bringing me on today. We've been talking about this for quite some time, so I'm glad that we're finally able to make it happen, and we're able to take both of our skill sets and help people when it comes to their own fertility, whether it's growing their families or preserving their fertility for the future. It's really an honor to be here with you today.
Thank you so much. My pleasure and my honor as well. Kim has a very huge following on Instagram, which she'll explain that to you. But Kim, why don't you tell all of us, how you got involved in this field to begin with. Nurses don't just start off in the field of infertility, not most of them don't anyway, but maybe it was your goal all along, I don't know. But tell us about that, and tell us what your most recent job experience was to help you be prepared to be the kind of expert that you are.
Absolutely. So I wanted to become a nurse because I really had a passion to helping people, and I love just learning about biology and how the human body works. I think it's just incredible. The reproductive system is one of many systems in our body that is just so crucial and important to our well-being. Reproductive system being critical to the survival of people, of civilization. And I initially did not plan on going into fertility medicine. It actually happens to be the topic of egg freezing, which is now huge on social media, or it's now covered in a lot of clinics I know here in Israel, and it's starting to be covered by companies in the United States. When I was in nursing school 8 to 9 years ago, no one spoke about egg freezing. It was more of a taboo topic. And the same went for IVF. It was really hush-hush. No one spoke about their struggles with fertility medicine. So I really didn't know much about the field. All I did know was that I became a nurse because I wanted to help people. Initially, I wanted to be working in the hospital, helping adults and elders with sickness, which is something that I still am passionate about, and I do work with adults and elders at times on a per diem basis. I had very sick grandparents, and it was just really important to me to help be there for not only the patients, but their family members who are impacted by sickness as well. And I also always had a strong interest in women's health as well, because my mother had very complicated pregnancies. I was born at only 6 months, so I was born 3 months early. I was in the ICU for 6 weeks, and so were my siblings. My 2 sisters also were born early. My mother had, she didn't have any difficulties with getting pregnant, but with her actual pregnancies, she was on bed rest, and she really needed just continuous monitoring and care. And she says that the nurses really were the reason why she was able to be successful and healthy, and is really the reason why I'm here today, is because of the knowledge and care from the nurses that they were able to give to my parents. And that's what I really felt like I wanted to give back to the world, and my talking in this world was to help women worldwide as well as their partners and their families. What brought me into the actual fields of infertility was after just 2 years of working on the floor as a nurse in New York City, I just felt like it wasn't the job for me. I didn't feel like the culture in a hospital was really allowing me to pursue my goals of educating and helping people. I really felt like I'm sure as you remember working in the hospital, it's just, there's all these politics, and you end up working for not just the patient, but the medical assistants and the doctors, and every single one is relying on the nurse at the end of the day. And I felt like I wasn't optimizing my skill set as a nurse. And that's when I started to explore out of hospital outpatient opportunities, and I was really open to anything outpatient. And it happened to be that a leading fertility doctor in New York by the name of Dr. Joshua Klein, he is the CEO of Extend Fertility, one of the leading fertility egg freezing clinics in New York and in the United States. We connected over LinkedIn, and I was invited in for an interview. And that's where I really built my skill set of educating women about their fertility and understanding the cycle, and helping women with freezing their eggs. And then I was really blessed that about a year plus later, I had a job offer from a very large, famous fertility clinic in New York called CCRM, which stands for Colorado Center for Reproductive Medicine. One of their founders, Dr. William Schoolcraft, is considered to be a pioneer in fertility medicine and has created techniques and procedures and just different methods of fertility treatment that have led to skyrocketing success in fertility in the field of fertility, leading to increased outcomes and fertility outcomes with an increased amount of successful births, live births from fertility treatment. So that kind of is what brought me to where I am today. And currently, right now, I just made Aliyah. For everyone who doesn't know this, I made Aliyah 4 months ago with my husband. For everyone who knows Yehudis, has been living in Israel for the past 20 plus years, and I was blessed to meet her son about 3 years ago at a wedding. And long story short, I convinced him to move to the United States for us to date and get married, and then we together decided to move back to Israel, me moving to Israel for the first time. And something that was really important for me, especially as a nurse, was continuing my nurse education, not just for myself, but for my followers. I really felt like as a 30-year-old woman living in New York amongst the modern Orthodox Jewish world, the constant questions I was getting was either from my friends who have not found their partner yet, and it's like, oh my God, clock is ticking. Everyone talks about fertility. Do I need to freeze my eggs? And then I found on the other hand, all of my friends who have been married, whether it's for 10 years or have been married for 2 months, starting to ask me questions about their fertility. Oh my God, when do I need to start seeing a fertility specialist? How long is normal for me to start trying? And all these big questions, which a number of them we'll address today on this call. And it really brought me to create the Fertility RN, which is right now a network it's a social media platform that is available for education, and we'll get into it shortly after how I'm now providing consultations, helping women exploring their fertility, as well as, God willing, soon to be offering classes online and speaking engagements to continue to empower women as well as their partners to really be supportive in the fertility journey. Because if anyone is listening and is going through a fertility journey or has gone through a fertility journey in the past, knows it's not just like, okay, let me go in for my appointment and fix the problem. It could take months to years of altering your own lifestyle and trying different techniques and different procedures and different medications to figure out what works for you. And so I find it to be really that this was my calling to help women and building their families moving forward. I just can't hear you. Yehudis.
Sorry, I was muted. Okay, so that was a really wonderful description of how you got involved in this, and it's a very valuable service that you're providing. We don't have that much time. We're only here for like 20 minutes or so.
Sorry.
We can make a much longer time at another point. But I just want you to maybe answer just a few questions if you could.
Absolutely.
Briefly, and then you can tell at the end how people can, you're currently seeing people internationally, online, and through social media, so you'll give all those details in a minute. But can you just tell us, what, like the most common questions, I guess if we came up with them together, patients are concerned, what is the appropriate time to start seeking to support for fertility treatments? How long after trying to look for the right place and have a few treatments, like how long does it take you to really know you're in the right place? Or that you even
in terms of exploring fertility treatment, something that's important to know is that for any couple that's younger than 35 years old, it could take up to a full year of trying with unprotected intercourse for a woman to, whether it's regulate her cycle, for there to be a proper cohesive step-by-step process that needs to take in order for conception to occur, and for once conception occurs to make sure a pregnancy does occur. That being said, it is normal that it could take up to 12 months for couples that are younger than 35 years old. For couples that are a woman who's 35 years old or older, they say that since your fertility does start declining with age, once it has been 6 months of trying without success, it's important then at that point to go seek out a specialist who could dig into some testing and some diagnostic blood workup or some ultrasounds or different kinds of tests to evaluate and see, okay, it's been 6 months if you're 30 or older, if it's been 1 year if you're 35 and younger. Let's take a look and see what next steps we could do to increase the rate that you'll be able to successfully become pregnant.
Okay. And what are some of the causes of primary infertility?
So
primary causes of infertility, but also
no, primary, the cause of primary infertility, and we could go into secondary infertility and definitely at a different time. But I can speak for the United States. I can't speak for in Israel in terms of the statistics. But today in the United States, 1 in 8 couples experience fertility problems at some months in their life. At some point in their lives. And this could be primary infertility, which is when they're trying to get pregnant right away. Or it could be couples who have 1 or 2 kids already, and for some reason, they a year or 2 later, 3 years later, run into difficulties, and they're perplexed. They're like, I don't understand. I had no problem getting pregnant the first time. Why is it so much more difficult? The number one factor is advanced maternal age. As we get older, us women, our fertility declines. We're born with all the eggs we'll ever have. And unlike our skin cells and our blood cells that are turning over constantly and rejuvenating, and we're just getting newer and healthier ones as we get older, even though our health does decline with age, our egg count is limited, it's finite, and we have the most eggs we'll ever have actually when we are in utero in our mother's womb. We're born with about 1 million eggs. That number goes to about half by the time we reach puberty. And then with each passing month, we are losing hundreds and hundreds of eggs, but only 1 egg ultimately ends up ovulating. So age is a big factor because the quantity decreases as well as the quality. Another big factor is our ovulation disorders. If a woman is not able to ovulate and develop a mature, healthy egg in order for it to come out of its follicle in your ovary and then go into the fallopian tube to come in contact with sperm during intimacy, during intercourse, during your ovulatory window, if one's not ovulating, whether it's due to a hormonal imbalance, it could be due to a inability for the ovary, for the follicle itself to launch out that egg for it to meet, conception cannot take place. And there are a number of other factors, but another big one that I want to touch upon is endometriosis. March is Endometriosis Awareness Month. Endometriosis is when the endometrium, which is the uterine tissue that is nice and thick to support your growing and developing fetus, uterine tissue sheds each month if you're not pregnant, and that's when you get your period. It's not just blood, it's all different tissues, the mucus and blood mixed together that normally is supposed to be a nice thick wall on your uterus for that embryo to stick to. But unfortunately, with women who have endometriosis, which is about 10 to 11% of the US population, they're finding that their endometrium is growing in other parts of their body other than the endometrium itself. So that could be tissue growing in response to hormones on your ovaries, in your fallopian tube, in the abdomen, on the pelvic floor, in different areas, which could cause a lot of pain, and also cause a blockage in your fallopian tube. And if there's a blockage in your fallopian tube, think of it as a highway is closed off. If you're going from Jerusalem to Tel Aviv and the highway is closed off, you are not getting to Tel Aviv, no matter how hard it normally is to get there. So these are just some of the main factors that are involved with common causes of infertility.
What does fertility decline mean?
So unfortunately, our fertility is finite, and the fertility decline will be that we have that set number of eggs. I like to kind of equate our 2 little ovaries as like these little piggy banks, those shiny piggy banks that you would see like in like a childhood bedroom. Unfortunately, instead of us putting coins in, these coins, which are our eggs, are only coming out each month. So those eggs or those coins are only decreasing as time goes on. And so that's why our fertility declines, because if there are less eggs that we're working with and the eggs unfortunately get worse with age, there's DNA damage that can happen, oxidative stress from our environment and our lifestyle, which is something that I'm sure you could really touch upon when it comes to acupuncture and Chinese medicine techniques to really improve your quality of your eggs. We can't necessarily increase our quality, but we could prevent further damage from developing. So if we're not taking on a healthy lifestyle or taking medications such as certain vitamins and supplements to help your egg quality, the quantity is going down as well as the quality. So our fertility really declines in the sense that each month with each ovulating egg that we have coming out from one ovary to the next ovary, chances are as our age increases, the number of good eggs declines and we're more likely going to be ovulating worse eggs with each passing month, making it harder to conceive.
Okay, so but it's not just an age thing. It's going to be a constitutional thing, correct? And of the state of mind, state of physical physicality the person's in. I mean, according to Chinese
Absolutely.
medicine, the state, the health of the parent, each parent, what they bring to the conception makes a huge difference too, right?
Absolutely, because quality, you can't have conception without quality. I'm not going to get into the great details about what happens at a chromosomal level and the crossing over of from the gametes from both parents. It's quite complicated, and I would not even call myself the expert on that. But ultimately, even though we're talking about like microscopic, teeny cells. The sperm is actually the smallest cell in the human body, and the egg actually happens ironically to be the biggest cell in the human body. Even then, they're microscopic. We cannot see an egg or a sperm or an embryo that has been created unless it's underneath the microscope. And we want to make sure that both the egg and the sperm are going to be coming from healthy parents, literally like the parent cells of each gamete. And that's why lifestyle is incredibly important, because even someone at the age in their mid-20s, I'm starting to see a lot of patients reach out to me and clients reach out to me that are struggling in their early 20s and they don't understand what the cost of it is. And I always say, your own lifestyle could actually really be impacting your cells at the DNA level.
Yeah. Right. So listen, just to explain to us, would you, what is the difference between IUI and IVF?
Great question. So a very common question I get from patients, they're like, I hear all the time about IUI, people are talking about it on social media, but what's IVF? Or I want to go through like someone's telling me I have to go through IVF. Does that mean I have to go all the way through IVF when I see a fertility doctor? When you go to see a fertility specialist, this doctor is called a reproductive endocrinologist. Reproductive endocrinologists are infertility specialists who have done their 4 years of training as OBGYNs, so they're full-on obstetrics and gynecologists, and then have gone on to do 3 years of additional subspecializing in a fellowship in REI medicine is what we call it. Now, when an REI specialist will see a couple that is struggling to conceive, and they're like, okay, you've been trying for X amount of months and you're struggling, let's see what the root cause of this is. Couples often think that when they are going to see an REI, that means they're going directly to IVF, which is in vitro fertilization, which is when we literally take the eggs from a woman, we harvest a number of eggs in a cycle, and we take the sperm from her partner and we inseminate them in a laboratory. And during that time is when the embryo will develop in a lab. Often now will be sent, a biopsy of that will be sent off for genetic testing, before it's re-implanted into the uterus. Now, this is incredibly helpful with advanced maternal age. If there is ever, God forbid, a crossover of genetic abnormalities between both parents, which we can't test all of them nowadays, but a lot of them are now able to be detected pre-pregnancy before one starts to try. And we're able to make sure that any embryo that which is called aneuploidy, which is not going to have its correct number of chromosomes. An embryo has to have 46 chromosomes, 23 chromosomes from each parent in order to develop into a healthy embryo, into a fetus, into a human. If one does not have the proper number of chromosomes, we're not going to reimplant that back into her body. However, that is a more invasive procedure of fertility. A lot of other treatments are done first, if possible, there are certain exceptions when couples the doctor will have them jump straight to IVF. But there are other procedures that are done prior to IVF to help women conceive, one of them being IUI. And just before I get to IUI, I want to share is that it could be helping induce ovulation, because sometimes ovulation could be the reason why someone's not getting pregnant. And if we could fix ovulation and we could time intercourse, that could also, I've seen so many couples, I've seen probably hundreds, if not thousands of couples who were just not ovulating. And once they changed their lifestyle and they got the proper medication to induce ovulation, they were able to become pregnant. Sometimes, if that doesn't work, they may now need to move forward to what's called an IUI, which is intrauterine insemination. It unfortunately gets this rep of a turkey baster method, like you take a turkey baster and insert that. That's not how it is done. That is a complete myth. The whole purpose of intrauterine insemination is that your doctor will be monitoring your ovaries and monitor that one follicle that normally will mature and develop with an egg inside of it. That egg will ovulate, or they'll give you a medication to induce ovulation. And then they'll take the best sperm that has been washed. It hasn't been washed like you would think of washing something. It's a term used for embryologists and andrologists working with sperm, to concentrate the sperm and insert that into a catheter, which will now go past the female's vaginal canal, cervical canal, and directly into the uterus, optimizing her chances of conceiving. This does happen to have a lower success rate than IVF, but it's far less invasive and often more cost effective. So a lot of couples will go to opt towards IUI before proceeding to IVF.
No, I didn't know that. It's interesting. Now, again, like, because this is not just really an in-depth conversation that I really prefer to have, but just it's just a taste of things. We'll do another one, I hope. Just tell us, when people call you, like, how do you discuss, like, what kind of questions? And they'll ask all these questions, but like, what will you tell someone? What kind of things will you recommend that they can do to optimize their chances of conceiving? This is the kind of thing you'll answer on phone calls with people, correct? When they do consultations?
Absolutely. So right now I'm starting to work with clients who are interested in learning more about their fertility. I always like to use a free 15-minute phone call to discuss with them what it is that I do in my background. I want to learn a little bit about them and what they're looking for, and then see if we are a good fit to work together and how I can help them optimize their journey. And something that I work on with my clients when I work with them in depth is I try to look at fertility as not just a medical approach, but every individual, like with every system in our body, we have to look at it from an objective, holistic lens. I really do believe it's not just your physical health, but your mental health, your emotional health. You can't just solve a problem with a pill. We are living in a society nowadays that thinks, okay, just prescribe me this pill and this will fix all my problems. But we have to actually really work to get down to the root of the cause. Now, we may not necessarily be able to fix the root of the cause, but a lot of times we could make changes that will expedite the problem. I'm sorry, let me rephrase that. Expedite treating the problem that wouldn't just be fixed by a pill alone. And so that includes managing your stress levels, which is hard to tell someone going through fertility treatment. Just don't stress, relax, it'll happen. Not what we say, but it's really working on skills to manage stress. Your diet, how you are treating your body and taking care of your body in order to, God willing, carry a baby for 9 months. You know, it's not an easy feat. It's something I've read recently was getting pregnant is kind of like carrying a ball uphill that's getting heavier and heavier day by day. You need to take care of your body in order to go along that marathon. It's not a sprint. It's a really long 9-month marathon. I would say, like we said, diet, I would say fitness routine, making sure you're getting blood pumping and moving. This is important though to talk to. There's certain prenatal specialists that I would recommend speaking with. I'm also in the middle of getting trained on what workouts are appropriate for pregnant women. We don't want you overdoing it, but we also don't want you lying on the couch for the next 5 months. Blood flow is critical for a healthy pregnancy, and really just trying to maintain as positive of an attitude as possible. I know that's easier said than done, but I really do believe treating your mindset will help you with all the other components that you need to take care of yourself when going through fertility treatment, and it'll help everything fall into place.
Wow. So when somebody calls you for a consultation, you will take them by the hand, step by step, into the whole process and prepare them, I imagine, to answer all these questions, talk to their husband if necessary, or their spouse, their partner. And you can make all these recommendations. And I've noticed on tell us about your Instagram page and all those cute videos, those amazing things that you interview so many people. Tell us a little bit about that. And can you put that on your screen, or I can do that tomorrow when I do the live?
I can't do it. I won't be able to do it right now, but I'm more than happy to share my information that patients could and followers and listeners could learn all about my page. But I really started this page, like I said earlier, really just to inform and educate women and their significant others about the fertility journey. I've actually had a number of men reach out to me recently, asking me about how can they optimize their fertility, because it's unfortunately fertility has a bad rap also for women, that it's a women's problem, but 30% of cases for infertility are because of women, 30% are because of men, 30% are because of both, and then there's 10% of unexplained infertility. So we don't know enough about that yet, but it's not just on the women, it's men who need to also start a healthy lifestyle as well. And so what I really like to do is, whether it's the man I'm speaking with, the woman, or sometimes both, I often encourage my followers, my clients who are doing this with their partner, to have their partner be involved if they feel comfortable with that, because I really believe that support is essential during a time like this. I really am into the hand-holding process. I find that in both the Israeli healthcare system as well as the American healthcare system, doctors just do not have the time to sit down with patients and explain to them, okay, let me walk you through what's going on with X, Y, and Z, and understand this. Often they say, okay, here's like a script, take care of this. Here in America, it's like a $500 bill for 30 minutes, and then you're out the door Googling things, more overwhelmed than when you came in.
And so you'll tell people, what medication might be prescribed and how they might feel on this medication, and how long it will take to take in, and how they take care of themselves during the process, and how to be patient, and what the chances are, all those things to answer those questions, because that's crucial for people. They need that support.
Absolutely. I go through with my clients about what to expect at your initial consultation. What are questions that you may have for the doctor? How to prepare yourself for that initial consultation. How to prepare. I just worked with a client who just had a procedure done in the Merkaz in Tel Aviv to have her eggs extracted. I spent an hour with her explaining what to expect before the procedure, what happens during the procedure, what to expect after the procedure. And then we had a follow-up 30-minute session 2 days after her procedure, checking in to see how she's feeling. And her doctor told me that she's never seen this patient so calm, because she knew what to go in and expect. And I think that is so important and will help not only patient satisfaction, but also increase patient outcomes. And I'm really excited just to continue to help men and women worldwide explore their fertility.
Okay, so give us your details, because they're going to shut me off now. So tell us about quickly your how people can reach you, and your Instagram.
So my website is in the process of being built, so I apologize that I don't have that available just yet, but you can find me on Instagram at thefertility_RN. And feel free to reach out to me. Anyone who's listening to me right now, please, let me know that you heard of my page through Yehudis' lives and videos. I'm more than happy, to give a special friends and family discount to anyone who is a friends, a family, or a client of Yehudis'. And I really hope I could just continue to help any of you that are looking for that extra hand holding throughout your process.
Okay, I'm going to make sure this is written on tomorrow. I have the ability to put this in writing. So thank you so much for joining us. It's incredible what you do, and really wish you lots of success, and wish patients will come to you lots of success as well, and having children.
Thank you, Yehudis. And I'm excited to bring you onto my page to talk about acupuncture, Chinese medicine, and fertility. We need to do that soon too.
Okay, dear. Thank you so much. We'll be in touch, and everybody will be in touch with Yehudis Schamroth, the fertility_RN.
Sounds good. Have a good night, Yehudis.
Thank you. Good night. Okay, just one last word about this interview. Kim is very experienced, as you can tell. She's very passionate about what she does. I would advise you to give her a call or contact her on Instagram, thefertility_RN on Instagram. Her email on the sidebar here is kimberly.sammet@gmail.com. You may contact her pretty much at any time, and she is so knowledgeable. She gives a free 15-minute consultation to see if you're a good working couple together, to make sure that you understand each other, and she will walk you through the entire process. And no surprises, and you feel so much better knowing everything in advance. Thanks for joining us. I hope to see you next month with another wonderful topic on health and wellness with RBS Acupuncture, Yehudis Schamroth. Thanks for joining.